My name is Usman Said. I'm a consultant ophthalmologist at the Royal Liverpool University Hospital, and today we're going to talk about age-related macular degeneration. The first thing is the structure of the eye. At the structure of the eye, at the retina, we can see there is the central part called the macula and the peripheral part called the retina. There are rods and cones in the retina, and the responsible part for appreciating light are the rods and cones. Light strikes the right rods and cones, which produce an action potential, and a signal is set up to the eye. The central part of the retina, called the macula, is responsible for the central vision. If the central vision is compromised, people can't see the central part of the vision, and people will be able to see the peripheral part. Why does this happen? It happens because of environmental factors, genetic tendencies, reduced oxygen delivery, causing drusen or oxidative damage, and these are shown here in the OCT scans of a patient with drusen buildup in the normal retina, and these are seen as a sign of degeneration of the retina. So it's an aging change, which is drusen, and the risk factors are age, cigarette smoking, uh, estrogen and early menopause, elevated blood pressure, sun exposure, dietary fat intake, as well as other factors. You can ask patients to look for macular degeneration by giving them an Amsler grid, and in normal, some people will appreciate a central visual field loss or a central problem. The most common types are dry and wet macular degeneration. 90% of people will have the dry type, and 10% will have the wet type. Dry macular degeneration is basically caused by wear and tear by varying degrees of atrophy. There might be confluent areas of drusen, or there might be areas of atrophy in the retina at the central fovea. The main thing about them is when you do an OCT scan, there is absence of fluid. So there's no appreciable fluid in the central layers of the retina. There might be atrophy, there might be central loss of vision, there might be uh, pigmentation or lack of pigmentation. And on an OCT and autofluorescence, you can see signs of RPE degeneration, RPE loss, and loss of autofluorescence. There's not much treatment you can do for dry macular degeneration. You can ask the patients to do up to date spectacles, low vision aids, nutritional supplements, which do uh, help in about 20% of patients. There were the ARIDS 1 and ARIDS 2 studies, which showed approximately 20% chance of uh, progression to wet AMD or advanced AMD is halted if you take vitamin supplementation. Cataract surgery unfortunately doesn't help with macular degeneration because the normal lens uh, has factors which are being produced, which reduce the chances of macular degeneration. But if a patient does get a cataract, there might be no choice but to remove the cataractus lens and restore some vision anyway, because without a clear lens, light cannot get to the retina at the back of the eye, and therefore vision will be blurred. So cataract has to be removed in patients who've got a significant cataract. So as again, the effect of diet does have some effect. You can give patients Preservision or other vitamins which you'd recommend. But the best treatment you can do is a balanced diet. Now, wet macular degeneration is a major type of macular degeneration which causes severe and rapid loss of vision. It happens because of choroidal neovascularization or abnormal blood vessels forming in the retina close to the fovea. These vessels break, they leak, they cause fluid in the retina at the back of the eye, they cause bleeding in the retina at the back of the eye, they cause significant structural damage over a period of weeks and months, and the vision lost is then permanent. Patients may present with with coming to the eye casualty by a fast track service, and the main thing that we can see on an OCT is presence of fluid in the retina at the macula. There are usually signs of central visual loss, You can do a fluorescein angiogram and an ICG angiogram to figure out and confirm what type of macular degeneration they have. And depending on that, they might be offered treatment with photodynamic therapy or intravitreal anti-VEGF injections or both. There might be different presentations uh, of wet macular degeneration with bleeding in the retina at the back of the eye, or just fluid at the back of the eye, or something else. The treatment options are anti-VEGF treatments with injections are the first line treatments, with injections being injected into the vitreous cavity, which then affect the central fovea and they cause significant visual improvement. The basic trials were carried on Lucentis, then on Eylea, and most recently on Vabysmo, and they all affect the vision, as in they improve the vision fairly quickly. They reduce the fluid in the retina at the central part, uh, causing structural realignment and structural recovery. Therefore, the vision usually recovers, and the main thing is that to maintain the effect, we have to give these injections whenever the effect of the injections wears off, and that's usually by a technique called uh, treat and extend of the anti-VEGF treatment. We can see that these patients have uh, different modalities of investigations that are required. They have fluorescein angiograms, they have OCTs, and once they have the injections, they have continuous OCTs at every injection or assessment period, which tells us whether they have fluid or no fluid, and then that shows us whether to treat them or not to treat. If treatment is delayed, the patients can get scarring as well as fluid, and they eventually end up with an end stage disease with central vision, which is completely lost. About 80 to 90% of patients stabilize with treatment with anti-VEGFs. There are lots of anti-VEGFs that are on the market, first starting with Avastin, then Lucentis, Eylea, Beovu, and now Vabysmo. And now you'll see a lot of generic anti-VEGFs coming onto the market in the next few months. There are a few other things that may mimic wet macular degeneration with postoperative CMO, with retinal vein occlusions, as well as other problems like vitreoschisis and vitreomacular traction, CSR. But that's why we usually ask for patients to have fluorescein angiogram and an ICG angiogram to figure out what the patients actually have. These are some other scans of other conditions which people can have. Photodynamic therapy was a treatment modality for wet macular degeneration, which had a specific type of variant called classic or predominantly classic CMO. Uh, Currently, we use Lucentis, Avastin, Eylea, Vabysmo, and Eylea 8 milligrams. And these are the trials that